Hello and welcome to the National Diabetes Prevention Program Summary Session with Sarah. My name is Sarah Yount and I have been a pharmacist for the last 10 years and a certified diabetes care and education specialist for the last 5 years. I was first introduced to the National Diabetes Prevention Program back in 2015 and I fell in love with it. I started delivering the program in 2016 and I have loved getting to see the changes that it has led to improve lives and prevent type 2 diabetes. Prediabetes impacts 1 in 3 adults. When I first began learning about this program, it was estimated that it impacted 84 million Americans, and just over the last 8 to 10 years, this number has risen to 98 million Americans. Unfortunately, we still have a very high number of individuals who do not know whether they have prediabetes or not. What is prediabetes? How do we know if we have it? And what are the risks associated with it? Well, prediabetes can be identified through testing your blood sugar. It's when your blood sugar is higher than normal, but not high enough to be called type 2 diabetes. Another way that's non-invasive that will help you identify your risk is through the CDC and American Diabetes Association's risk test. This test goes through multiple questions identifying factors that would put you at a higher risk. It looks at age, gender, history of high blood pressure, what's your current level of activity, and what your current weight is. If you score 5 or higher on this risk test, it would qualify you to participate in a program that would help lower your risk for developing type 2 diabetes. In addition to an increased risk for developing type 2 diabetes, having prediabetes also puts someone at a higher risk for developing heart disease and stroke. Without intervention, it's estimated that up to 30% of those with prediabetes will go on to develop type 2 diabetes within about 5 years. We know that uncontrolled type 2 diabetes leads to issues such as blindness, kidney failure, loss of toes, feet, or legs, and these are all due to the fact that it impacts the tiny vessels that we have in our body. The large vessel problems will lead to potential heart disease and stroke. In 2002, a study was conducted that looked at the impact of lifestyle modifications on the risk for developing type 2 diabetes. And what they discovered was that through different approaches such as healthy eating and increasing physical activity, structured lifestyle change reduced the risk for developing type 2 diabetes by 58%. Thus, we can essentially cut the risk for type 2 diabetes in half through implementing certain lifestyle modifications. So what is this structured lifestyle change program? Well, it is the National Diabetes Prevention Program. The program plays out over the course of 12 months. The first 6 months include weekly sessions where we're really trying to set those foundational skills that we can build on throughout the course of the year. Once the first 6 months are completed, we move to monthly sessions to close out the year. Topics that we discuss throughout the year include nutritional aspects. What does it mean to look through a nutrition label? How do we utilize this when we're shopping to get the most value in what we're eating? Physical activity topics. Not everyone enjoys the same physical activity. Not everyone is going to start at the same physical activity level. So how can we identify things that are desirable and doable on an individual basis? We also recognize the impact that stress has on implementing changes. So we do have several topics that cover the social emotional aspect to lifestyle modifications as well. Goals in the program are to move more. This is defined by increasing physical activity to about 150 minutes of moderate intensity activity each week. Again, this is to be set by the end of the first 6 months, not right out of the gate. Better blood sugar is something we hope to see by the end of the program, and this is defined by a decrease in A1C by 0.2%. Remember, A1C is that 3-month picture of how your blood sugar is doing on average. Another goal, which is would be to see modification in our body weight. This is represented by a 4 to 7% weight loss over the course of the program. This is just a snapshot of what the National Diabetes Prevention Program entails. If you're interested, I would love to speak more about it with you. Now it's time for you to decide what your next steps are going to be. To find out more about the program and our upcoming classes, please scan the QR code on the screen or click the link below.